Good morning, everyone. Welcome to today's BIOFLEX Basic Certification Training. The name of the game here is to give everyone a solid foundation in photobiomodulation or cold laser therapy or low level laser therapy, or there's a whole bunch of different names for it. So some of you have been using BIOFLEX already. Some of you are interested in it. Some of you may be using other equipment or what have you. So there's lots of good information out there. My goal is to use a strong foundation in science and research and evidence-based results so that you can see what this is all about and understand it and maybe add it to your practice or to train you because you already have the equipment or will be getting the equipment. So that's my goal today. It is a certification test, which basically means that there'll be a very straightforward test at the end of it. I'll be emailing that to everyone. You don't have to write the test right after. You can do it whenever you'd like. There's a link to it. It's very straightforward. You can see your results right afterwards. And once you pass, which is 70%, and really you shouldn't have any difficulties passing, then I'll be sending out a certificate, a PDF certificate indicating that you've taken the course. So that's how the day will unfold. My background is as a chiropractor and acupuncturist. Over the years, I've been practicing for almost 30 years, and I got interested in laser therapy after I had my own injury, so it's kind of a personal story. Ended up coming to the clinic here well over a decade ago. I fell off a roof, unfortunately, and had some spinal injuries and fractures, and it was a pretty nasty series of injuries. So I was already into my rehab for over a year, and it just wasn't going very well for me. So I ended up trying laser therapy, and that really helped. And I had a very preliminary understanding of laser therapy. I didn't even use it in my practice at that time. So I decided to learn more about it. And essentially, as I learned more about it, and my background is in molecular genetics and molecular biology, I started to read the science. I got super interested in it because of the mechanism of action, how it works. It made a lot of sense. And it turns out that there's a huge amount of evidence for it. So that got me interested in it. And that's sort of where I am today. Okay, so unless there's any other burning questions, I'm sorry that some people are having difficulties with connectivity, but because everyone except for one or two are having difficulties, that would really mean that it's more on the other end as opposed to my end. So a little bit about Meditech. We obviously are in the business of laser medicine, and there's different types of laser medicine. The most common that most people, the general public, have heard of is using lasers specifically to help burn tissue or heat things up, like surgical lasers, that kind of thing, or tattoo removal lasers, or lasers used in dental applications, those kinds of things. But of course, there's another form of laser medicine, low-level lasers, which most of the general public are not aware of, and that's of course what we're involved in. Now, as a company, we're very unique because we actually are a clinical-based company. We have a large outpatient clinic. We have physicians and chiropractors, physiotherapists, and massage therapists. We're all helping patients get better. And we all, as the main form of therapy, use our equipment and use low-level laser therapy. We've been doing this for 3 decades. So we have a very strong foundation in understanding what this type of therapy can do, everything from wounds to concussions to the most common types of scenarios is arthritis and musculoskeletal issues. And that's sort of where most people will be using this type of equipment for. But we also manufacture the equipment. We're an ISO certified company, a medical device company, so a class 3, which is fairly high, and I'll talk a bit about that as we move forward. So we do offer a lot of professional development. We feel education is the key to understanding how to get good results with your system and with photobiomodulation in general. It's a therapy, right? So it's not just a modality where you kind of have a few settings or what have you, and it's straightforward. Low-level laser therapy is somewhat complex because there's so many parameters and so many different things going on with the patient that one needs to be aware of to get good results. So you need to understand the basics in order to achieve really good clinical results, and you need to have experience as you treat. Just like if you're being trained in acupuncture or how to prescribe a medication or chiropractic manipulation or soft tissue manipulation, you start off having a basic foundation and then you gain experience and you get better and better at it. So laser therapy is no different than that. We do a fair amount of research and development. We do that both on the clinical practical side and on the engineering, software, and hardware side in order to try to make our equipment even more effective. So we do a lot of that as well here in Toronto. We offer clinical and technical support. I'll chat about that shortly, but that's a key to your success, is being able to talk to clinicians like myself and Slava Kim and Nathan and Randy. All our clinicians here have quite a bit of knowledge, and you can use us to help you get even better results as well. And lastly, this is a bit of an investment. If you're looking at purchasing, these things aren't cheap, and of course you can get really cheap laser therapy devices out there, but there's quite a bit of a difference between something you can buy for a couple $1,000 or significantly more, and that really revolves around the equipment itself, the software, the proprietary protocols, and of course the clinical support and education and other things that we offer. So we are a true medical device company, and we're not something that we sell on Amazon or other sites. We're obviously not like that. So that's what we're about, and hopefully you enjoyed today's session and learn a lot from it. So really, to understand our company and what we do, I'd like to introduce you to Dr. Fred Kahn. He's our CEO, physician. He is now retired as a physician, but he was practicing as a vascular surgeon for many decades, got his training at University of Toronto, McGill, and other sites throughout North America. And he established a practice and was the head of surgery in a hospital in California. So he practiced there for many years. And when he came back to Toronto and he's kind of semi-retired, he was very active, and he would have been in his early 80s at that point, I think. And still very active and skiing. Well, actually, no, he would have been in his 70s. Skiing, that kind of thing, and golfing. Ended up having a shoulder problem, I guess probably torn rotator cuff or impingement, one of those types of deals. And he was told he needed some surgery. And as a surgeon himself, he was like, yeah, maybe not surgery. Maybe there's something else out there that would be helpful. So he ended up talking, I guess he knew a chiropractor that had laser therapy. So he was getting some treatment from the chiropractor. His name was Dr. Don Fitzritson here in Toronto. And Don had a very basic, archaic at the time, well, actually now it would be archaic, but at the time it was cutting edge laser therapy device from Russia or the Soviet Union at the time, because the Soviet Union were one of the early adopters of this type of technology back in the 70s and 80s. So long story short is Dr. Kahn had very good results with his shoulder, to the point where he was like, what's going on here? Well, why did my shoulder heal so quickly, so well without surgery? And he had no idea about this type of therapy. So what he did was he started to reach out to researchers in the field and clinicians and start to understand it. And the more he read and the more he talked to these researchers and clinicians, he decided to actually get more involved. And so essentially what spurred him on was a entrepreneurial program in medical devices at Ryerson University. So he had some prototypes made and he started to do some clinical trials, mostly on things like, arthritis and injuries, musculoskeletal injuries, that kind of thing, had quite good results. So based on all that, he decided to use this equipment for a clinic in Toronto. So that was the first ever BIOFLEX laser therapy clinic in downtown Toronto. At the same time, he decided to get Health Canada approval and ISO certification and FDA approval and clearance. And he brought this to market. At the same time, he started to actively use only BIOFLEX laser therapy in his practice, seeing all sorts of different types of conditions, including wounds and so forth. And he was getting tremendous results. And so that's really the origin of the company. The equipment has changed over the years. And we're into our second and third generation of our equipment and our software. We still operate a large outpatient clinic in Toronto in the West End. We had a satellite clinic in downtown Toronto. We've actually just recently put a pause on that one because of COVID. So all the patients have been switched to our main clinic here in Toronto. As I mentioned, we do a lot of product development and research and development. We actually have a separate engineering building here in Toronto, and we actually manufacture and build and assemble everything here in Toronto. The parts might be made from all over the world, everywhere from Japan and other countries, but everything is assembled and checked here in Toronto. One of the interesting things that we also look into are new types of indications. When I say new types of indications, I mean there are approved regulatory indications that we can market or advertise for. And there's not a lot of them. And the reason for that is in order to get a new condition approved by Health Canada or by the FDA or CE, it's a huge undertaking. You have to apply for it using research, clinical trials, and so forth. And you can imagine the cost involved for something like that. So most of the time, it's going to be indicated for these very basic conditions like your arthritis and pain and those kinds of things. But there's lots of other conditions that it can safely and effectively be used for. And that's where you would be using it, quote unquote, off-label. So as long as it's safe and not contraindicated, and as long as it makes sense that photobiomodulation can be helpful, then you can use it. Now, you might say, well, what protocol should I use? Well, you have to understand that the protocols are set and designed for the approved conditions. And we have all those in the software. If you can't find a protocol for something you want to treat, you call us, right? You say, hey, Dave, hey, Slava, or Nathan, or whoever, I want to treat this particular condition. You don't have a protocol, where would I start? How would you help me out starting this to treat this kind of condition? So that's where we're helpful because probably we've seen it, although we haven't seen everything, but we've seen a lot over 30 years. And so that's where we can help. But please don't call and say, what's the protocol for concussion? There is no protocol, right? There's no approval for it. No one on this planet has approval to treat Alzheimer's, autism, neurodegenerative disorders like Parkinson's, post-stroke recovery. There aren't protocols, but we understand the basics of how to approach treating it and give you some guidance. So that we can do. So hopefully that's clear to everyone. Our equipment is worldwide. We have lots of clinicians that use BIOFLEX. We're a small company. We don't just sort of smash these out and sell millions of them because you can probably understand that number one is that it takes some time to understand how to use the equipment, how to be properly trained. You should be a clinician, obviously, if you're treating other patients. So there's a lot to it. Now, that being said, we're growing and growing, and we have lots of really interesting clinicians that use our equipment. If you had a chance to listen to our masterclass a couple weekends ago, one of the keynote speakers was Dr. Ashley Banjan, a neurologist from Durban, South Africa. And he's been using BIOFLEX in a hospital setting in an outpatient clinic for 3 years now, and treating neurological conditions, including Parkinson's and post-stroke recovery, paraplegia, all sorts of things, sciatica, you name it. And he's been getting amazing results. Now, if you're interested in seeing those lectures, they're all posted now on our website. So you can go to events and you can see them. It's recorded. Of course, there's a fee, but if you're interested in that kind of thing, then I think that will be very insightful. And we have physicians and specialists, but the main users of our equipment tend to be rehab specialists, like your physiotherapists and massage therapists and chiropractors, those kinds of clinicians, as well as naturopaths and traditional Chinese medical doctors. Those are the ones that tend to use photobiomodulation or laser therapy. As I mentioned earlier, we're an ISO 1345 2009 company. All that means, well, it's a big deal, because ISO certification means that what you manufacture actually is checked and audited so that everything is exactly as it should be. So medical device ISO certification means that what you're buying is something that has been certified and to be made sure that it's safe and effective. We have Health Canada approval, FDA clearance, and CE in Europe and other countries as well. So all of this takes a lot of regulatory red tape that gets every year more challenging to jump through. We've had to change things because they've become a lot more stringent with respect to providing clearance and approval, especially to the claims that you make. So that being said, we know what our device can do, but we don't have 30, 50, $100 million to do these clinical trials. So we rely on the research that's published, and there's a lot of it. So I'll share some of that as we go forward. So our equipment is very unique, and it consists of software and a computer, and it consists of hardware. One of the pieces of the hardware is this, what we refer to as the dual array, DUO, meaning two colors, and array of lights. This particular device that you're looking at right now is not a laser. It's actually 180 or 240 high-powered LEDs. They're actually a hybrid LED. They're called supraluminous diodes. They're packed together very tightly to provide a fairly high energy density and to treat a large surface area and volume of tissue. And I'm going to talk about why that's so critical when you're using photobiomodulation. So that's one of the pieces of equipment. They come in different sizes. I mentioned 240, 180, and that really is the amount of surface area and the number of diodes that are there. These arrays are flexible. They're designed to contour and touch the skin. So when you're treating, you want to make sure that these touch the skin as efficiently as possible. So in other words, when you're treating a shoulder or a knee, they'll bend and curve, and those diodes protrude out and touch the skin. And the reason why this is so important is that you want the light to directly go into the skin and through the skin into the tissue. If it is held a distance away from the skin, then light reflects. Up to 85% or thereabouts of light will reflect right off the skin. So the whole thing here is that that when you reflect light, it's not going to be absorbed and make a big difference. I have a question here from Jennifer that this particular device looks different from the home system. Indeed, that's correct. The concept is similar, but our home or personal devices are meant to be used, once or twice a day, and the durability and how it's designed. The professional grade equipment, which is what you're seeing here, of course, it's designed to be used, 10, 12 times, whatever, a day, 5, 6 days a week. And the way it's designed is to last and be more robust. It's kind of the difference between professional grade, whatever, and a home grade. They're made differently because of how they're used, right? So hopefully that answers your question. The next piece of hardware is the laser probe. So this is the second portion of the treatment. Now, this is where we get into lasers. These are class 3B lasers, and the definitions we'll get into as well. They are designed to touch the skin and provide intense light in a very small surface area. And the purpose of the laser probe, whether it's the infrared or the red, is to provide lots of energy in a very small area, and that energy will be accumulated to the greatest depth of penetration that light can go to. This may seem a little confusing right now, but don't worry, I'll be getting into all the details shortly. So we do like to comment on how we use the equipment and call it a two-step approach. Even though there's kind of three things going on here, I voted for three-step approach, but I was vetoed, so it's a two-treatment approach. But regardless, the first step, which is really two steps, is using the array. So this large surface LED array makes contact with the skin, and the first light that's emitted is red, approximately 660 nanometers in wavelength. This is hands-free. So if you're treating, in this case, the wrist, you strap it on, you turn it on, and now red light is treating the wrist. You do not have to be with your patient during this first step. And the red light stays on anywhere from 5 or 6 minutes to 8 to 10 minutes. And this varies depending on the condition that you're treating and the anatomical area that you're treating. When this red light finishes, you'll hear a beep, and then that automatically the same light diode that was emitting the red light now emits infrared. So that's the part B to the first step, is now it's emitting infrared light. And very similar to the first step is that now you have infrared treating the same area that you just treated with red in approximately 840 nanometers of wavelength for another 6, 7, 8, 10 minutes. So in total, this hands-free portion of the treatment will be anywhere from, I'm going to say 10, 11 minutes total to maybe double that. It all depends on what you're doing. So this first step is hands-free. Now, once that is done, you take it off and you move it either to another area that you're treating, or in fact, you start to use the laser probe. Now, I do have someone that's raised their hand, so so I'm not sure if you have a question, Benavides, but if you wanted to unmute yourself, you can ask your question. Hi,
yes, good morning.
Hi, good morning.
So you said, sorry, I kind of jumped in. You said about 6 to 7, 8 or 10 minutes in between the LED array, red light and infrared light. And the total would be 10 or the 20 minutes. Now, depending on the condition and the anatomical condition, how would you determine it? Is it by pain, or how would be?
Right, right. So I'm going to mute you and answer your question, okay?
Yes, thank you.
Okay. Great question. And I know you guys will have tons of these kinds of questions. I guarantee you that by the end of today, you will understand the basis of how long to treat, those kinds of things. But just so you understand, it's a range. So it could be 10 minutes, 12 minutes, 14 minutes, 18 minutes, 20 minutes. And the range depends mostly on the depth of the tissue that you're treating. So if I'm treating a hip joint, it's going to be longer. If I'm treating something superficial like the hand, it's going to be shorter. But also there's nuances about if it's acute or chronic, other things like skin color, body size, those kinds of things. So there's lots of different factors that will determine whether or not you treat for 10 minutes in total or 20 minutes. Now, 20 minutes is unusual. That's more like the hip joint or really deep areas. On average, it's about 10 minutes, 10, 12 minutes, but there's some areas that will be a little bit longer. So hopefully that answers your question. And I'm not sure if I pronounced your name right, so I do apologize. Benavides, sorry, I'll move on. Okay, so now, all this equipment is basically, oh, I do have another question here. Is in one of your pictures, it shows them using both probes at the same time. Is this possible? If so, do you have to follow the red probe with the infrared probe? The standard probe that we use is infrared. Now, depending what equipment you have, if you have our new dual port or multi-port, you can use two probes at the same time, and you could use red and infrared at the same time. If you have both our probes, usually you do the red one first, then the infrared. But most people just have the infrared probe, and they're going to use the infrared probe. Now, the equipment has protocols. The software has embedded protocols. It depends on where you live. So geographically, what country you're in will determine the regulatory approval for what protocols are in your software. Some countries have a lot more protocols, other countries have a few or less. What we can offer though is if you want all of the protocols and put some of those ones in later, then we can send you what's referred to as the full manual of these protocols after you purchase. The reason for this is because in the United States, in Canada, in the EU, in the UK, in Australia, they all have different rules about what is approved, what's not approved. So there's a few, not a lot, but there's a few that in Canada may be different than the United States or in Europe or what have you. And that's not a problem because we can provide all those. You just have to customize and put them in yourself. But these preset protocols are basically either a very specific condition like Achilles tendinopathy or an anatomical region like foot and ankle, okay, or cervical spine. And these protocols, which I'm not going to go into yet, so don't ask me questions yet about these protocols, but you can see they're basically in different stages. Stage 1, stage 2, stage 3. And if you look at the stages, you'll see treatment head, frequency, duty cycle, and duration. Okay, so let's briefly talk about that. Treatment head means, is it the large surface dual array? Is it red or infrared? So that's what dual plus red or infrared means. LDI 200 refers to the laser probe or laser diode. Frequency, CW, means continuous wave, meaning the light is coming out like a light bulb, where it's constant light. But if you see a number like 10 or 50 or 1,000, that means that it's being pulsed out like a strobe light. Do not ask me yet the importance of that, because I will talk about it. Then duty cycle is referencing if you flash the light or pulse the light, how intense is that light? Is it really bright or is it weak? That's what duty cycle is. And then lastly, duration. I've already mentioned that earlier. I said, in general, when you apply the array, it's about 10 minutes. So if you look here, or 10 or 11 minutes, if you look here, it's 5 minutes of dual red and then 6 minutes of infrared in one location. So that's about 11 minutes. Then for Achilles, you're going to move it to a second location and then treat for 5 minutes of red and 6 minutes of infrared. So that's another 11 minutes. Then you're going to use the laser probe for about 6 to 8 minutes. Again, I'm going to explain how you do this as well. Okay, so in this case, when I'm treating Achilles tendonitis, I'm using the array over 2 areas. I'm going to treat the insertion of the Achilles tendon, and I'm going to treat the mid-tendon portion and the musculotendinous junction. So I'm treating 2 areas. That's why you see these 2 separate durations. I hope that's clear. Now, second is that stage 1, 2, and 3 is increasing dosaging and increasing stimulation. Okay, you don't need to know anything more than that yet. Okay, so stage 1, 2, and 3, you increase stimulation. I'm going to give you a little bit of an analogy. If a patient comes in for the first time, and I'm going to, say, manipulate their lower back, I have to have an understanding of, is this patient easy to adjust or difficult to adjust? How much force should I use? Now, I'm not going to probably use as much force as I can muster the first time, because I want to see how they react and how that I can manipulate their back, right? Then as I get used to their spine or whatever it is I'm adjusting, I will probably use a little bit different force, and maybe a little bit more, a little bit less, but you need a starting point. So stage 1 is your starting point. And if it works well, then I'm going to continue with stage 1. If it's not working well and it's not enough force or not enough energy, I'm going to go to stage 2, and so on and so forth. So that's the understanding. Always start at the lowest level. And most of the time that works quite well. But if it's not working, you're going to increase things. And I'm going to talk about this again a lot more in depth as we move forward. Okay. Right. So these protocols have placements. I already mentioned earlier for the Achilles, I may do a couple placements. In the manual and the software, you'll see some recommended placements depending on what you're treating, like a heel spur or plantar fasciitis. I have a separate webinar that is the practical sort of video of these placements, and I'll be sending that out to everyone today at the end of the lecture. Okay. Unfortunately, it doesn't work very well through Zoom webinar to do this live. So I have recorded a specific webinar that shows you all these different placements. So I won't be covering that specifically live, but certainly you'll have that access to that as well. Further, the software allows you to choose the protocol, like Achilles tendonitis or shoulder or what have you. It allows you to input the patient's name and information, and it allows you to customize and alter the protocol. So the analogy I give here is that you're given a protocol, you're given stage 1, okay? If you've ever cooked before, you start with a recipe. And I guarantee you that if you've cooked something more than a few times, you're probably not looking at the recipe anymore. And you're also probably making some changes based on preference, right? So a protocol is there to be used, and they work really well. But you may decide to change them a little bit based on each patient, because each patient's an individual. That's where you can customize and use the software to slightly tweak the treatment time, the frequency, the duty cycle, all of these different parameters. And that's where understanding the software and how to do that, and understanding photobiomodulation, that's the goal today, is for you guys to understand all these different parameters. Okay, I did mention as well that we do a lot of professional development, like this basic certification training. I mentioned about a masterclass. We also do advanced trainings. The next one is on the cervical spine in September. I did one for the lumbosacral region earlier in the year. And I have one on cosmetic and sort of well-being and age-related conditions in December. So if you're interested in those, you can sign up for those as well. So we do a lot of that. I also do, other things as well, like free webinars. We do have a support page so that if you have purchased our equipment, you can actually sign up specifically for these webinars, or you can see software downloads, you can see marketing downloads, those kinds of things. So once you have our equipment, you get a password and username, and then you can access all this type of stuff. The webinars that I do, and you probably notice that sometimes I stall here because I'm trying to read different things that come up on my screen that I have to kind of deal with as well. So these free webinars, I do a couple or 3 a month. Usually there's a professional one. Professional meaning that it's for use with our professional grade equipment. Anybody can listen in and watch. But of course, they're designed more for healthcare practitioners for the basic understanding of the conditions that we're treating. And I also do one for the personal home system as well. More geared towards the general public. So I think I've already mentioned about clinical and technical support. You can email or call us, and we can certainly help you out with that as well. And technical support is obviously if you have any issues with the hardware, the software, and we have service technicians, again, that can help you out there. And we have a really good engineering team, and they really do try to adapt and make this equipment as effective as possible. So that is the end of that lecture.